in knowledge of this early treatment. And so we worked to fill that gap, one by increasing knowledge. And while hospital systems like Larry's at Lee Health and here in Tampa at Tampa General had been embracing monoclonal antibodies really since they were given emergency use authorization at the end of 2020, many physicians did not know about it, and it was not something that was being utilized to the fullest extent. So we saw that gap. We saw that folks were testing positive. We saw the admissions escalating, and we wanted to provide help for people. So we started talking more about the notion that COVID is a treatable illness, that there is an ability to get early treatment, and if you do it early in the form of monoclonal antibodies, the track record has been very, very good. And so we worked in August to expand that message, but also to expand access. And so we stood up over 25 different sites throughout the state of Florida, including one right here in Hillsborough County. We did one in Pinellas, Manatee, Pasco, all up and down the state. Many of those, or all of those, could see over 300 patients a day. We were doing 4,500 patients a day at the peak, and we're able to provide, I think no doubt we've kept thousands and thousands and thousands of people out of the hospital and saved many, many lives. And if you look, since we went and did this, you've seen a huge decline in daily hospital admissions in the state of Florida. The statewide COVID census continues to go down. I think it's gone down 27, 28, 29 days in a row, and we continued. We are confident, or we believe that that's going to continue on a positive trend. And so this early treatment does work, and it's something that we wanted to make available for Floridians. We were excited a few weeks ago when President Biden said that the federal government was going to be increasing the shipments of monoclonal antibodies to the states by 50%, because we had been using it to great success. This is a thing that obviously I was out promoting it and letting people know it was there, not forcing anyone to do it, it's their choice. But what's very powerful with this is when you have folks who are COVID positive, particularly are a high-risk population, and they sometimes feel really, really bad. And they go in, they get the treatment, and then the testimonial about how effective it was. So then they tell their friends, family, neighbors, hey, get this. If you get COVID, get it. It worked for me. And that really, I think, did more than anything to raise the awareness. And so we've seen other states mimic what Florida has done. I get people writing into the governor's office from other states thanking Florida for putting this on the radar, because they had not heard of this in many other parts of the country, just like there was a deficit of knowledge about it here in Florida. So we were really excited to hear a 50% increase, because this is a treatable illness. It was something that people had not been discussing the way they needed to. And here we thought, man, what Florida is doing, that's going to be happening all over the country, and we're going to continue with what we're doing. Instead of increasing by 50%, HHS seized control of the Regeneron nationwide, decided that it would dictate how many doses would be available statewide, not just for state sites, but including the hospitals. And so they had a dramatic reduction in the amount of Regeneron, and they're reducing it even further for this upcoming week. So to put it in perspective, the most recent shipment that we're scheduled to receive for the entire state of Florida is a little less than 18,000 doses of Regeneron. Our state sites, just a few weeks ago, were doing well over 30,000 doses just in our sites. That doesn't even include any of the hospitals. So not only have they cut dramatically from what we were using, they're now saying this is also what the hospitals get as well. So we're in a situation where we have to now send to the providers that need it. So statewide in Florida, where we had 45,000 doses a week just a few weeks ago, we're now less than 18,000 doses of Regeneron. So we have to provide to Lee Health, we have to provide to Tampa General, and we have to provide for our sites. And that's not a good situation to be in. That is not a 50% increase. That's a dramatic reduction. And I would hate to see somebody who really could benefit from this treatment not be able to have access to it when we know that the track record has been very, very positive, not just in the clinical data and real-world data, and of course Florida being the most recent example where you see thousands and thousands of people being kept out of the hospital. So cutting the medication to Florida and other states is wrong. It's not consistent with the promise that was made just a couple weeks ago, and we are going to continue to fight against that. At the same time, I, as governor, have a responsibility to do everything I can to provide help for folks who need it. And so, yes, we have much lower hospital numbers, much lower cases. Everything like that is much better than it was a month ago. But at the same time, COVID doesn't go away. At the same time, we do see people who are vaccinated who've tested positive much more frequently than we had anticipated just 6 months ago. And so we know there's going to be a continuing need to make this early treatment available for folks. And so I'm in some respects, sad that I have to announce, but I am happy that we're not just sitting on our rump. We're making things happen. So the state of Florida has been able to acquire an additional 3,000 doses of the monoclonal antibody sotrovimab, which is manufactured by GlaxoSmithKline. It got emergency use approval just a few months ago. The clinical data that they had was really, really strong. In fact, it was even stronger than Regeneron, and we know Regeneron's been very, very effective in real world. So we're going to be able to use that sotrovimab to bridge some of the gaps that are going to be developing as a result of the Biden administration dramatically cutting medications to the state of Florida. Now, the sotrovimab is an IV only, whereas the Regeneron is approved not just for IV, but also subcutaneous injections. The folks you'll see here who will talk about what they were able to get at our state-supported sites, they all got injections. Injections are easier. It's 4 shots, 2 in the belly, 1 in each arm. They do observe you, just like they would observe when we did vaccines. You want to see if there's a reaction. So they do observe for an hour, but you can go in and get it quicker. The IV takes a little bit longer to administer, and so that will, even though we have these doses, we're going to use them, you're not going to be able to do 320, most likely, doses at a given site. Nevertheless, we're happy to be able to have acquired this. We are going to put it to good use, and we're going to continue with our state sites. At the same time, we may have to be making decisions soon about how many of the sites can remain open. We're making decisions about how many doses each hospital is going to get, and these are not decisions that we should be having to make. Clearly, these are not decisions that would need to be made if they had increased the allotments by 50% instead of dramatically cutting it like they did. But sotrovimab is coming to the state of Florida. We are going to be deploying it, and particularly for our high-risk population, we want them to be able to, as soon as they test positive or as soon as they develop symptoms, to be able to come in and get that early treatment. I think the results have been very good so far, and I anticipate, given how strong the clinical data has been with sotrovimab, I anticipate we're going to continue to see very positive results going forward. Now, I do want to say, as much as it's been good, we've really helped change the narrative nationally by making this available. Many people are interested in this early treatment throughout the country. You know, this has been something that's been being done in Florida really for the whole year. And Larry down at Lee Health has been doing, as I mentioned, I did an event a month or two ago at Tampa General. They were doing the clinic, they were doing some of the experimental treatments even before it got the emergency use. So Florida hospital systems, many of them have embraced this and have had a lot of success with it. We've now really, I think, increased the understanding of it, the public awareness of it, and of course, we've made it easy access. And so, but I want Larry to be able to come up and be able to talk about how they've used it at Lee Health, and I think how they're going to continue to want to be able to draw down supply of these very effective early treatments. So Larry, the floor is yours.
Thank you, Governor DeSantis. The monoclonal antibody program has really been a game changer here in the state of Florida. We know, based on the studies, that if you give monoclonal antibodies within the first few days of diagnosis, you can reduce the hospitalization rate by 70%. This is incredible. And if you look at just at our region in Lee County, the state has given over 8,000 doses. You can imagine how many people have been saved hospitalization. And it's reflected in what we're seeing. At the peak of this Delta surge, we were admitting 80 to 100 patients a day with COVID. Now we're admitting in the mid-20s. And our census has gone from 652 down to 251. So it's made an incredible difference. It's getting people better. It's getting people better quicker. It's keeping them out of the hospital. And I think you'll hear some testimonials today from patients who received this antibody, and they'll tell you that it was easy, it was well run, minimal to no side effects, and they felt better quickly. So I want to thank the governor and his whole team for doing this. It's made all the difference in the world here in Florida.
Okay, well, we're happy to have some folks here who've been able to benefit from the monoclonal antibody treatments. So the first is Luke Castoria. He had heard about Regeneron. I mean, the first time most people heard about Regeneron was when President Trump got it, and that was not even on the market yet at the time. It was experimental. Lou tested positive recently, and he was able to utilize it, so he's going to come up and tell his story.
I'm going to read from a prepared statement. So I'm Lou Castoria. I'm 58 years old, and I live in Land O'Lakes, Florida. I'm a senior software developer for a large financial firm based in the state of Florida. Before I get started, I'd like to thank the governor and his staff for having me out to tell my story and making monoclonal antibody treatment available widely in the state of Florida. I started feeling ill August 29th. Through the day, I felt worse and worse. Sunday evening, I assumed that I had COVID-19. At that point, I decided to get the monoclonal antibody treatment. I went to the Florida Health Department's website, clicked on the link, scheduled my appointment for Tuesday. Monday morning, I went to the doctor and was tested for COVID-19, and as expected, I was tested positive. So then on Tuesday, for my appointment, I went there, and at this point I was feeling much worse. I had 101 fever, rapid heart rate, and very tired. I then got the treatment, and by Thursday evening, by Tuesday evening, I was feeling much better. My fever had dropped, and by Wednesday I had no fever anymore, and by Thursday I was able to return to work. Now I work remotely, so I wasn't going to get anybody infected, and today I'm back to 100% with no lingering issues. Thank you.
Thank you. Okay, we have Betsy Palmer Bigler. So she's a former math teacher and science teacher from Pasco County. She has her husband received Regeneron, and then they're being in the same household. She received it before she even tested positive prophylactically, so she's going to come tell that story.
Thank you so much for having me here. I'm very happy and delighted to share what happened in our household with the COVID. My husband was unknowingly exposed by a coworker and started with some flu-like symptoms. We had bought home rapid test and tested him, and he was positive. And right away, his employer told him about the Hudson and Pasco facility, Mike Fasano Health Department, and he went and received the injections. I myself was scheduled for about 10 days out for a surgery. Also, I have high-risk factors, including high blood pressure and age, and went right after him. So we drove separately, but were able to get right in. Everything ran very smooth, fast, easy, experienced, knowledgeable people there, and we received the injections. And I was able to get the surgery because I never contracted the COVID after getting the monoclonal antibody injections. I was very concerned about him. He's a 30-year smoker, also diabetic, so I was more concerned for him than really myself, especially with respiratory complications that might happen. However, that never happened. So he had a fever for several days and tired for a few days too, but was able to kind of bounce back. Also in our household is my 80-year-old father-in-law with congestive heart failure and diabetes, and after a few days, unfortunately, he did test positive, and he went the same day and received the injections and only had about a day and a half of a 99-degree fever. So our household was really interesting in who needed it and why, but we all received them and all came through just fine. And That's the reason I wrote the governor's office with a lot of gratitude in my heart, because I sincerely feel that it saved, probably one or all three of our lives, being able to have those. So anyway, thank you. Thanks.
Okay, Jeff Randall is a guitarist. He's in a band, lives in the area, and so he's going to talk about his experience, but also I think your mother as well did it. Is that true? Yep, go ahead.
Okay, well, this is all new to me, so thank you all for being here, and thank you for letting me speak. My personal story is that my wife and I started getting sick, and we started getting sick with COVID. We took the home test, tested positive. My name is Jeff Randall. I'm 64 years old. I've suffered 3 heart attacks. So having COVID-19 is not what you want to hear when you've suffered 3 heart attacks and you've already got a breathing problem. That's not what I wanted. We proceeded to go to Hudson, Florida, to the Pisano Center, which you aptly provided everything we needed, and they were fantastic up there at Pisano Center. We go in, fill out a questionnaire. They lead us to another area where we get our shots, lead us to another area where they want to make sure we're not going to have any reactions to the treatment that we received. After that, I started to go home. Everything's fine. And within about 2 to 3 hours before that, my body ached. I always thought COVID maybe was not real, but it's real. It hurts your body, your bones, your muscles, your headaches, your fever, the nausea, the chills. It makes you want to cry, a grown man cry. After I'd had the shots, the treatments of the Regeneron, within about 2 to 3 hours, I actually started feeling better. And I mean better. My wife will attest to that because I'm a big crybaby when I hurt. I didn't hurt anymore, and it felt great. Within a day or two, I was ready to start eating again. My appetite came back, and everything's fine. The day I got my Regeneron shot, let's say is a Wednesday, the next morning, my mother, who is 93 years old, wakes up the next morning on Thursday and says, I have chills, I'm cold, I have a headache, and I got a slight fever. Well, we didn't waste any time. My wife took my mother back to the Hudson, Florida Pisano Center and had her get the Regeneron shots as well at 93 years old. The next day, it's like a miracle, and I'm serious when I say that. She is feeling fine. She is completely healed. She walks around with her little walker, and she gets along just fine. So I guess my story would be that this Regeneron does 2 things. Number 1, it made me better. It made me healthier. And number 2, I think more importantly, it kept me out of the hospital, freed up a hospital bed, freed up a nurse, a doctor for somebody who really needs that person at that time. So thank you very much, sir.
Thank you. Okay, then we have Charles Craig. He's a handyman and contractor, and he tested positive for COVID. This was last month when the sites were just starting, and was able to come in and get it. And also he has a 62-year-old father-in-law who also got it. So you can talk about both of those.
All right, my name's Charles Craig. I'm 40 years old from Apollo Beach. Start off by thanking the governor and everybody that's made it possible to have this. It's awesome. Thank God for Florida. My wife found out that she had COVID through work. She works for an orthodontist office. She tested positive on a Monday. That Thursday, I tested positive. The very next day, Friday, my father-in-law tested positive. Going back to my wife, her symptoms were minimal at the beginning, so she didn't pursue anything. Mine were immediate. My kidneys felt like a horse had kicked them. My chest felt like I had a sumo wrestler sitting on it. So Friday morning, I went in to get the treatment. It was the first day that the agricultural center over at the state fairgrounds had opened up. Got the treatment. By the time I was going to bed that evening, no temperature. Kidneys had already started to relieve. The next morning, My chest was was fine. It was back to normal. Friday, when my father-in-law had tested positive, he went straight to the hospital. I got the injections. He is 62 years old, stage 4 non-alcoholic cirrhosis, diabetic, poster child of somebody that should not get COVID. So he went straight to the hospital. He got the IV version of the treatment. They sent him home. That his oxygen levels never dropped below 96. His symptoms were minimal, especially for somebody in his condition. The great thing about him, he tested positive on a Friday. The following Friday, he was negative 7 days. I tested positive on Thursday. By Saturday, I was negative. He was 7 days, I was 8. My wife, going back to her because she didn't get anything, regretted it. Her symptoms got bad towards the end of hers. She tested positive, as I said in the beginning, that Monday. She didn't test negative till well after the 10-day mark. So to think that they're limiting the access to this is like sickening. It works. It's awesome. Another reason you know it works. In the beginning, hydroxychloroquine worked. They grabbed it. More recently, ivermectin worked. They grabbed it. Now they're grabbing our Regeneron. I just want to thank the governor for doing everything in his power to stop it. Thanks.
Great. And the monoclonals are really the only EUA from the FDA of any of the early treatments. They have done an EUA, maybe even full, for some hospital treatments, but this is really the only one that's got the emergency use authorization, Regeneron, the Lilly, and then now the Sotrovimab. And so this is something that's really, really important. It's helped a lot of people. We not only have these testimonies, and we've got other folks here who came who have also been able to use it, and it's made a big difference for them. It's clearly saving lives, clearly keeping people out of the hospital, but it's also something that, even short of being hospitalized, this is something that can really knock you on your rump for a week or two. And we have mothers, fathers, people working, running businesses. It assists in the recovery. I mean, people get better much quicker if they get this early treatment. And that has implications far beyond just healthcare issues. You're talking about looking after kids. You're talking about being able to make ends meet, making sure that if you have a family business that it's going. So this has really, really significant positive implications. When you get it early, it makes a difference. We don't want to see this cut. We want to see this, they embrace what Florida has done, embrace these stories, and make sure, I mean, which one of these folks, should have been denied this had they cut this 2 weeks ago? Who should be denied going forward? I mean, my view is if you fit the criteria, it's not for every single person that tests positive, but particularly people, once you get over 50, between the comorbidities and the age, you're talking about a lot of people that can benefit from this. We should be doing everything we can to get them the treatment, not cut the treatment. So the fact that the Biden administration is doing this, I just think is wrong. The implications are going to be, I think, negative. It may mean less access. We may have to close sites. The hospitals may not have all that they need. There's a whole host of things. So this is just fundamentally wrong. At the same time, can't just sit on the sidelines and carp about it. You got to do something about it. And so our announcement today that we have secured a shipment of the Sotrovimab, the newest monoclonal antibody from GlaxoSmithKline, that's showing that we're going to leave no stone unturned. And if there's somebody that needs a monoclonal antibody treatment, we're going to work hard to get it to them. This is a different brand than the Regeneron, but quite frankly, it's had phenomenal success so far in every metric that's been studied, and I'm pretty sure it's going to be very good for Florida patients going forward. So we'll have further announcements about how exactly that's being deployed once we get it. It will be at least one or maybe more of our state sites. Very well may also be sent to some of the hospitals. And so Sotrovimab will be in the state of Florida very soon. I wish we didn't have the Regeneron cut like we've had. I think that's a huge mistake. But we're going to try to do whatever we can to fill those gaps. Okay, happy to take some questions.
Governor, what does our supply of Regeneron currently look like right now? And are you expecting that we're going to see shortages happening now in our hospitals and our state sites?
So for the most recent shipment that we're allotted, which will probably arrive next week, we're getting about almost 18,000, a little under 18,000, so about 17,000, I think, 800. That's for the whole state. That's just not for our 25 sites. That's for Larry's hospital system. That's for Tampa General. That's for every hospital as well. So the total Regeneron that new into the state of Florida will be 17,800. To put that in perspective, we were doing just at our state sites a couple weeks ago over 30,000 treatments. That's not even counting what the hospitals are doing. So they were doing, 10 to 15,000 treatments a week statewide. So you're going from well over 40,000 to now 17,800. That's a significant cut. How the shortages develop, well, obviously that depends in part on demand. We've had strong demand partially because they say, oh, well, Florida is using a lot of it. Yeah, because we're pushing it out there for people. We're not making anyone do it. We're telling them this is here. They know it's here. When they're testing positive, they're opting to do it. They're talking to friends, they're talking to family, and they see the results, and so they're doing it. You want states to be using the full capacity. Even Biden's administration acknowledged when we first launched our sites that this was something that was very underutilized throughout the United States, and it was. And I've talked to different folks who really believe in the early treatment, and they said that if this had been kind of the standard response, someone that has a lot of these risk factors, any of these risk factors, test positive, that they immediately went to do it, we would have kept thousands and thousands of people out of the hospital nationwide this whole year. We would have saved tens of thousands of lives had this been there. And the thought that we have people who are just being told, go home, there's nothing that really can be done, when there is something that can be done, that's a really, really bitter pill to swallow. And so what we said in Florida, we're going to do something about that. I mean, when Regeneron came out, I was talking about it. I thought it was neat. Understandably, it got overshadowed by the vaccines. But I think as we've seen now, you need prevention, but you also need treatment on the back end. You can't do just one or just the other. You really have to have both. And so that's what we're doing here. But we could potentially see, because of how much reduction in Regeneron, you could potentially see shortages. My hope is that just, there's fewer people that need it. And between our sotrovimab and we stretch and figure out, you may also be in a situation where we may have to collapse some of the sites. You also could be in a situation where we may have to restrict the criteria beyond what the emergency use would be. So, for example, using it as a prophylaxis. Yeah, if you're in a nursing home, you're going to use it as a prophylaxis. If you're just somebody who's, normal age, normal health, you may not qualify as a prophylaxis. So those are going to be decisions that will be forced upon us to do, and I hope it doesn't come to that, but we were upset at the initial cut, but then this next week is cut even more, and this is a dramatic reduction, make no mistake about it. Yes, ma'am.
Regarding the Gabby Petito case, police tell me that on the ground today there are 75 law enforcement officials searching for Brian Laundrie. So first, do you think that we should have more people looking for Brian Laundrie right now? And second, when all this is said and done, do you support a review of how police handled this case?
So I was able to get a briefing from some of the folks involved in it today. They thanked the state of Florida for providing what they said was incredible support to the search effort, and that support has been across multiple state agencies. And I sent the message that we're here to help. We want to do more. If there's anything more we can do to make an impact, we want to do it. We need justice in this case. This is somebody who, this beautiful young girl, and to just see her murdered like that, and we need answers 100%. So we've been engaged in it across multiple agencies. We'll be there. Obviously, the FBI, because it's interstate, is taking the lead, and then you have the folks down there in Northport who are also doing a lot locally. So, but we're in this fight. We want answers and we want justice.
Governor, have you spoken to Gabby's family at all?
I have not spoken to them, but I can tell you, if you look at like Northport, that whole community is galvanized about this. It's really incredible, the outpouring. Most of these people never met her probably, but you see how it's really impacted this community. And I know that I think they're doing something this weekend for, and I know she's got a lot of folks who really know and care about her up in New York as well. So it's really a sad thing. But we viewed it as important from the beginning. Obviously, it started as an FBI, but the state of Florida has sent a lot of folks there to help, and we're here to do more if need be. Okay, thanks everybody. We'll see you soon. Thanks, guys. Great job. You guys did a great job. You did such a good job. Thank you. Great job. That was awesome. Of course. Great job. You guys did a great job. Yeah. Thank you. See you tomorrow. Just let us know what you need and.
Okay, yeah, we'll use it. I mean, we're doing about 50, 60 a day.
And you're doing all in.